Okay, in this module, we're going to go over the abdominal examination. Now, an abdominal examination and a private functional medicine practice is totally different than an abdominal examination in an emergency room hospital setting where people have severe liver disease and ascites and jaundice and all those things associated with it. So what we'll cover in this course is just going through the normal abdominal examination. We want to do inspection. We want to go in there and do percussion. We want to auscultate. We want to palpate. And we want to see if there's any signs of any kind of functional imbalances or any signs of any subtle mechanisms that may require us to do some testing. For example, if we see any tenderness over the liver, we might be suspicious of things like hepatitis. If we see a lot of air or gas or bloating or distension, or if we hear any changes in bowel motility sounds that are really aggressive, we can see that with intestinal inflammatory disorders. We might also look at the bowel sounds in a functional model to just really hear if they're efficient or not. So those are things that we'll go over in this module during the abdominal examination. Okay, so when you have the patient laying down during the abdominal examination, you want to make sure their legs are comfortable. Sometimes you want to have them bring their knees up, especially as you do percussion. But initially, when you just look in visual inspection, just take a look at the abdomen, see if there's any asymmetries that are happening, and then have the patient take a deep breath in and a deep breath all the way out. Sometimes you won't see things happen until you have some deep respiration to show you what's happening. You want to look at the belly button. You want to see if there's any asymmetries or scars that are happening. You want to see if there's any type of stretch marks, any kind of discoloration, any patterns of jaundice that are involved. And that's just your basic visual inspection of the abdomen. And from there, what you want to do is you want to then look at the different quadrants, and you want to go ahead and just palpate the abdomen itself. Now right here is, you can see the liver area here. You can just go in here and just right underneath the rib cage, you can just poke in. You gotta be very careful when you do this. When you do palpate, you definitely want the knees up. That'll relax the abdominal muscles. And then as you come in here, you're just gonna go underneath the rib cage here and just gently get your hands past the muscle contraction. Once their muscles are relaxed, you just want to push in there and you can actually feel the liver. Now, if the liver is extending past the rib cage, you're a little bit concerned. And you can actually even just cup the liver when you do this. This is one of these types of exams you really want to make sure your nails are not long so you don't cause any discomfort to the patient. And you can just kind of feel that there's always a little bit of shock when you first get on the liver. People sometimes, as soon as if you get on it, they'll kind of just jolt a little bit because it's really sensitive. And then you just want to go around here. You shouldn't really feel the spleen unless it's enlarged, the splenomegaly. You just want to go in here and just palpate and make sure there's no masses there. And then you can just do a general palpation. Just feel intestines. Sometimes if you're feeling something hard, it can be a fecal lith. Fecal liths are just stone impaction. If you're dealing with a patient that has lots of constipation, you may feel some little stones that are there. Even a patient may complain of a little area of tightness or thing, especially if you have constipation. And then you'll hear some abnormal bowel sounds when you look at that. And then you can put your hands right here and then have the patient take a deep breath in and then all the way out. And then you're feeling that pulse there. You can see with my fingers, that's the abdominal aorta. You can see that there. And you just wanted to see it's around about 3 centimeters, about the normal size. If you feel like a increased bulge or pressure on one side, increased mass, then you may be concerned for something like an abdominal aneurysm. Now, the next thing to do is to then do percussion. And with percussion, you can have different sounds. If you go over the muscle, over like the thighs and tap here, that's like a flat sound. And then if you go over the liver area, that's like a dull sound. If you go over the lung area, that's a resonant sound. And then if you go over the abdomen, it's a tympanic sound, air sound. So those are what normal sounds should sound like. And then you just first want to get an idea of where the liver is. So you can start at the mid-clavicle line and just kind of palpate here. You should have resonance. And then you can start to see it gets dull. So that's the upper border of the liver. And then you go down here, you have that tympanic. and then it gets dull. So you can see the liver is right around this area. This will help you identify if someone has an enlarged liver, if it's bigger in that sense. And then as you go over the spleen area, you shouldn't have any type of dullness unless there's any enlargement of the spleen, which we don't. Now, for some people that have lots of distension and gas, you'll have this hyperresonance, and sometimes it's just they have just a lot of gas from their gastrointestinal imbalances. Sometimes people swallow air and they get really distended abdomens. If you see a distended abdomen and instead of hearing this hyperresonance and you hear more of like a dullness, then that's fluid, that's ascites, that's a serious problem. But in functional medicine practice, you don't really see people with those severe liver diseases. But always remember, they should always be tympanic. Any dull sounds over the abdomen, you're thinking of fluid buildup, and then really where the fluid buildup is where you'll have that dullness. And then you want to auscultate. So you have the 4 quadrants, and the 4 quadrants can give you a general idea of some sounds, but sound transmits all the way through, so it's not as specific as you would like for each quadrant. And you just want to hear normal bowel sounds, normal growling that happens when people are hungry. And you just want to go through each of the quadrants. You got to be careful. If you push too hard, you can cause contraction and get some abnormal sounds. So you want to be very gentle with this, and you want to go through all 4. And you can take your time in listening to the bowel sounds. Now, normal bowel sounds as you're going through should just be normal contractions. Then you can look at the intensity, the frequency of contractions to get a general idea what's happening with the gut motility. If you listen to the abdomen for 5 minutes and hear very little sounds, especially in an area that's abdominal obstruction, if you're really, really aggressive sounds, really, really aggressive contractions, that can happen when the intestines are inflamed, or if there's an obstruction somewhere and the abdomen is really trying to get that to move. The most common cause of functional obstructions are going to be those fecal, those hard stones that take place in the abdomen. Okay, so the abdominal exam is something that can be done relatively quickly. Just in a few minutes, you can get a really good assessment of the GI tract. With some people, you're going to need to spend more time with it. If you suspect some kind of pathology or some kind of abnormalities, you may take more time with auscultation. But generally speaking, just having a person lift their shirt or their gown so you can just basically see their abdomen, bottom of the rib cage to the bottom of the pelvis. You can see that nice belly button, see those 4 quadrants, just see if there's any symmetry. And then see if there's any bloating or distension. And you're going to see a lot of patients in a functional medicine model with bloating and distension. If you see bloating and distension, you definitely want to start percussing and making sure that you hear that tympanic sound. If it sounds dull with percussion, that's fluid, and that's a problem. That needs to be investigated with imaging and follow-up testing, and you're worried about ascites, any kind of liver disease or things of that nature. Now, when you're going through and palpating, you're definitely going to have people that have extreme tenderness in their abdomen. And some of these people have pain syndromes, they're very intolerant to pain. And if you see that, you definitely want to go do a pinhole exam, see if they have any types of allodynia or hyperalgesia. That just might be the first time you see it when you're doing your abdominal exam. That'll maybe explain some of their symptoms of chronic pain. For other people, it's normal to have some degree of sensitivity, but as you let them relax and bring the knees up and put your hands in gently, you'll be able to see some things. Now, you're going to find a lot of people do have swelling and pain in the liver and have undiagnosed hep C, so you're going to have that happen to you as you start doing these on a routine basis. They may not know it until you do run some routine laboratory. Sometimes patients will tell you they have pain over their right side, like just usually their liver getting inflamed and swollen, and sometimes it's just gas and discomfort causing distension there. And then you're definitely going to feel people that have these fecal stones, especially if you're dealing with a patient that have constipation. So be aware of that. Now, as you get into the auscultation part of it, it's pretty rare in your career you're going to see severe abdominal obstruction that needs medical referral, right? But you're going to hear people that have functionally low bowel sounds. Okay, so when you listen to bowel sounds, you should hear the frequency, how much contraction you're hearing, like the rumbling, how intense it is, as a clue of what's happening with those muscle contractions. So just think of the intestines as muscles contracting. When people have healthy gut function, you should hear nice loud contractions, and it should be frequent. So you should hear like a contraction, relax, contraction, and it should be fairly clear to hear. People that have impaired gut motility, people that have things like SIBO, people that have early Parkinson's presentations in their gut, people that have their brain-gut axis dysfunctions, you may hear very weak, faint bowel sounds, and you may also just have big periods of time between one sound and the next when the gut is just not as functional or as efficient as other times. So those are things you definitely want to do in your exam. If you haven't been doing abdominal examinations, it's definitely something to build your skills on. And you'll sometimes find patterns of pathology, but more than likely just trying to look at their gut and get a general idea what's happening with their swelling, their abdomen, their gas, any signs of swelling, especially against the liver, and then also if you feel any kind of fecal liths, and the efficiency of their bowel contractions. Thank you.